Good day, grade 9. Today is our MAPEH Health in the 4th quarter, week 1. My name is Rinaldo B. Malimban. In our learning objective to gain complete understanding of the importance of first aid, to understand how incident happen accidentally, and to understand first aid concepts. Let's talk about the safety and the first aid. People today feel the need to do things that entail the adventure and enjoy life. In order to live and experience a full life, man must integrate safety into his human behavior. Accidents can be avoided usually by taking single safety precautions at home, at work, and on the road. Now, what are some accident prevention? But before that, I give you some question. What is safety and first aid? Rather, first aid is to help given to a person until full medical treatment is given. Safety being protected from the danger or injury. So having good first aid knowledge is important to health and wellness. In accident prevention, why do you need an accident prevention plan? In prevention of accident also involves changing or improving the physical environment. Safety makes it possible to person to perform fun work in safe manner. Accidents affecting to the children and elderly usually occur in the home, while older children or young adults are most likely injured while playing some sports. So the accidents affecting adults tend to be on the road of the work. Awareness and the common sense are the key to accident prevention and treatment. In accident prevention, the preventing accidents is critically important. To supervise plays a key role. Supervisors need to deal with many issues. Certain techniques are useful for effectively lead others by the DoFam BBS. And this season reviews these tools and techniques to assist your supervisor. In the safety and first aid, also accident prevention follows safety rules, prevent falls, poisonings, electric shocks, and fires, and how to act toward strangers. And also, we connect also in internet safety. The introduction of the first aid is an important skill that should be taught in everyone who has ability to learn. If more people knew first aid, more lives will be saved. Myths and old fables are still being used because of the ignorance. A proper training would result in a vast difference between life and death or being handicapped. Now let's move forward the chapter of the first aid. Now, what is first aid? First aid is an immediate and temporary care given to a person who suddenly gets ill or injured. Includes self-help and home care if medical assistance is not available or delayed. So from the first aid is the immediate and temporary care given to a person in case of an emergency or sudden illness. For severe accident, death, permanent damage can occur if first aid is not given properly. Now, these are some of priorities in first aid. Dangers assist the situation. So we also to remove these victims from dangerous situations like fire, flood, and explosion. To respond shake and shout, response, lateral position. So let us also to check if the victim's breathing and feel if there is pulse or heartbeat. Airway, look clear and tilt head. It provides artificial resuscitations if necessary. It makes certain that the victim has open airway. Breathing also look, listen and feel. So to check for bleeding, head or neck injuries or serious body injuries, control the bleeding and spend fractures before moving the victims. Circulations, carotid pulse. If the victim poison, check to guide the poison before administering first aid. Dangerous bleeding, head to tooth also to check. So it always call an adult when the accident happened. Recheck the EBC every 2 minutes. Now, if the administered first aid is fast as you can, always call a doctor if the injury is serious. Now, what are some do's and don'ts? So what do you do? So please, can you like or to dislike or do or to don'ts? And these are some dangerous first aid mistakes everyone keeps doing. So those are the example. How can you control or to prevent some of these areas are doing their own mistaking to give an actual from your as a first aider. Okay, that's all. Now let's move for the part of the first aid kit. In the first aid kit, we'll prepare you to treat minor illnesses and injuries and to deal with more serious injuries until victim can receive the medical help. So you have to be alert to dial local emergency number. Always check the kit periodically to be sure any used items or expired medications are replaced. So these are some supplies for your first aid kit. We have the rubbing alcohol, povidone iodine, hydrogen peroxide, cotton swab, band-aid, gauze pad, gloves, bandage, triangular elastic, roller bandage, pin light, safety pins, forceps, scissors, tweezer, medical tape, splints, and also the tank depressor. Other are not included. We have here the large triangular bandage, the antacid, antibiotic ointment, antiseptic wipe, antihistamine, the dosage spoon or eyedropper, and also the safety matches. Also to include the paper issues or first aid manual. And that is the source coming from the Reader's Digest or Good Health Handy Tips on USA or the Red Cross. As I said, these are the example of the first aid kit. Next slides. So what is the difference between prescription drugs and over-the-counter drugs? Prescription is a written order from the doctor for a specific medicine, while the over-the-counter or OTC, medicines that can be bought without prescription. So these drugs should be always be in your medicine cabinets. pain reliever, aspirin, the acetaminophen, effective of like aspirin, antacid. These drugs overcome the effect too much acid into the stomach. Example of sodium. Laxatives are used to relieve constipations. Anti-diarrhea. This drug should be used only if the diarrhea is very serious rather. And emetics. These drugs make you vomit in case of accidental poisoning. So it is good to keep several medicines at home for various illnesses as long as all directions are followed and all expiration dates are monitored. Let's move on for the first aid characteristics of good first aider. In the characteristics of good first aider, we have the gentile, should not caused by the pain, resourceful, should make the best use to things at hand, observant, should notice all signs, thankful, should not be alarmed the victim, empathetic, should be comforting, respectable, should maintain the professional and caring attitude. So a person who will be administered by the first aid must be possess the following characteristic. A basic knowledge of first aid, can make the quick assessment of the accident and able to give the effective remedy. Must not show the nervousness and be able to explain the case of assist the medical personnel as need as arise. Now, let's move on for the basic first aid. In the basic first aid, the one is the gentle, does not caused by the pain and panic. Resourceful, makes the best use of things at hand. If you are a first aider, if you are also a first aider, you have to observant, notice all signs. Another first aider that can include thankful, does not frighten the victim. Also, the sympathetic, comforts the resources of the victim. Respectable, maintain the professionals and caring attitude. So this basic of first aid is based from the research of learner material for the PE and Health in Grade 9 Department of Education or DepEd. Now, what are some types of injuries? So these several types of injuries which demand first actions. In this case, it is important that protective measures be taken immediately. We have wounds and hemorrhage, shock, respiratory emergencies, poisoning, animal bites, fractures, sprains, strains, losses, and burns. These are some examples of the types of injuries. You have the sling, neck brace, sprain, fracture, whiplash, cut, graze, bruise, splinter, sunburn, burn, bite, and sting. In wound hemorrhage injuries, that hemorrhage or severe bleeding, in the severe case of emergency, it can be external or internal. In external bleeding, the blood escapes from the capillaries or veins or arteries, while the internal bleeding refers to bleeding or profuse escape or blood from one of the body cavities. Now, how to control bleeding by? In the direct pressure or elevations, apply the direct pressure to wound site with your gloved hand. Second, Apply firm pressure with a sterilized dressing or clean cloth. Third, apply pressure until bleeding is controlled, maybe 10 to 30 minutes or longer. Fourth, hold dressing place with bandage after bleeding is controlled. 5. Never remove the dressing once it is placed. So in the place of the tourniquet just above the wound but not touching its edge, tightens that enough to stop the bleeding. So remember, the punctures would closely quickly sealing of oxygen present to the air. This condition is favorable for growth of tetanus bacteria. This kind of wound must be treated immediately. The common causes of such bleedings are bullet wounds, crushing injuries, perforated ulcers, punctures, wounds, and other organs injuries. In the external bleeding, from our first aid guide, you have to use protection. Why? Because your safety should be always come first. You have to check for any hazards before approaching the victims. So you use gloves as protective barrier. If you do not have gloves, then avoid direct contact with the victim's blood. You can intrusive barrier to prevent direct contact. Another is identify and examine how the victim sit down, reassure the victim and get their consent. Carefully expose wound and check for the foreign objects. Do not remove. Remove any clothing that prevents examinations of the wounded area and assist to the wound. If the injury is severe, call an ambulance. Third, use direct pressure. When profuse bleeding occurs, you need to act fast. Using your gloved hand, apply direct pressure to the injured area. If there is a foreign object or embedded in the wound, apply pressure around it and call for the ambulance. If the victim is unable, allow them to apply the direct pressure on his own. Remember that the victim might go into the shock with lots of blood lost. Fourth is the immobilize the wound. It is possible to immobilize the injured areas to reduce bleeding and continually monitor the injured area. Fifth, dress the wound and pick up the appropriate dressing for the wound. Apply the dressing directly to the wound, bandage or firmly. Make sure the dressing is not too tight to avoid cutting or off circulations. If there is a foreign object embedded in the wound, apply a pressure bandage around it. If the blood seeps through, apply another second thick bandage on top of the injury. Do not remove original padding and bandage. Call for the ambulance. And the last, clean up. No matter how many precautions you take, there is still chance that you can come in contact with the body fluids of the victim. Again, if the blood comes in contact with open skin and eyes, wash with warm, soapy water and seek medical assistance for immediately. So take note of that. So what you should do, the external bleeding, apply compress and cold pack on the wound, elevate the injured part, and apply pressure to affected blood vessels to stop flow of that blood. Let's move on for internal bleeding. Internal bleeding may be difficult to recognize. You should always suspect to when constantly show signs, symptoms of the shock or has been involved an incident that may have caused internal injuries. So there is a little that can be done when there is internal bleeding. Keep the victim down and quiet. In the internal bleeding, severe bleeding can occur from blunt force or object penetrating the skin and internal structures, resulting in the bleeding occurring inside the body. This is the sign of symptoms for the internal bleeding are pain, tenderness, rigidity of abdominal muscles, coughing up blood, and passing urine or faces red color. Another type are shock. Now, what is shock? There are four parts of the shock. The one is the hypovolemic, cardiogenetic, obstructive, and distributive. What is shock? Any injury or illness can be accompanied by the shock. Because many lives has been lost due to severe shock. The body's physiological reaction to the physical emotional trauma. Psychological shock results from severe emotional trauma. The symptoms included pale, cold and moist skin, and breathing is rapid and shallow. Victim has quick falls and blank stare. So it depending on the severity, shock can lead the unconsciousness and even death. There is often shock in emergency situation. Always check for shock. Now, how to treat your shock? From the first aid from the shock, do not give anything to eat or drink. Keep he or she warm, not hot, but use for blankets or clothes. Lay the victim on his or her back, but do not move him, her, if their back or neck injury. Raise the feet and legs with a pillow. Next is the fainting and shock. How to help someone who fainted. If a person suddenly collapses, check breathing. If breathing stops, call 911 or give CPR. If person is breathing, keep the person flat on his or her back. Monitor breathing. If it stops, give CPR. Check and treat any injuries. Wipe person's forehead with a cool and also the wet cloth. And these are some points of fainting first aid. Why should you do? Sometimes pains leave her laying down. Loosen tight clothing. Wipe face with cold cloth. And also the clinical shock. Seek for medical help immediately. If do not, give person any food or drink. Do not slap face on splash water to try retrieve persons, and do not also leave persons alone. Again, for your first aid fainting, lay a person on the back, elevate legs to restore blood flow to the brain, loosen tight clothing, and then say something, hey, try to revive person, shake or yell. Then call the 911 if person doesn't respond. And if person is not breathing, start CPR and continue until help arrives. Next, let's move on for Heimlich maneuver. In Heimlich maneuver is an emergency procedure designed to expel an obstructions from the victim's airways from producing an artificial cough. If this is not successful, call for medical help. Caution: a baby requires different first aid techniques for choking. So stand behind the victim and put your arms around his waist. Place your first fist with the thumb above the navel but below the ribs and breastbone. Holding your fist with your other hand, give us to 5 quick, forceful, upward and inward thrust. Do not squeeze the ribs with your arms. Use only your fist. Pause briefly between thrusts to check for the size from the victim that object has come up, coughing, speaking, and deeply inhaling. So how to do the Heimlich maneuver? In a Heimlich maneuver for choking victim, stand behind victim. Place your arms around victim's waist. Make a fist, place thumb side on the face against victim's mid-abdomen. Grab the fist the other hand. Give the quick upward thrust into the abdomen. Repeat till stuck object pops up. For standing or sitting adults and kids older than 1 year, use for first for larger person, less for a child. After 5 thrusts, check the victim's mouth to see if the obstruction has come up. Repeat the sequence until the person comes up object and becomes unconscious. While the Heimlich maneuver may be necessary to restore the victim's breathing, abdominal thrust can damage the liver and other internal organs, and therefore should also the physicians immediately. Again, how to prevent the shock? Shock can follow any severe injury, particularly if there are severe burns or blood loss. Blood loss can be internal so that you may not see any blood. First aid treatment for all severe injuries should include the measure to prevent or a list of minimized shock. Now let's move on for the electric shock. Now this electric kills hundreds of people every year and causes severe internal and external injuries such as burn, broken bones, damaged tissue to many others. When rescuing the electric shock victims, you need to be especially careful. Treatment will differ according to the cause of accident. So how to prevent shock that's entailed of this electric shock? In preventing electric shock, keep electrical appliances away from the water. Don't use lightweight extensions, cords with small appliances. Don't overload electrical outlets. Don't use damaged appliances. If the victim has received an electric shock from household appliances, switch off and current at the breaker panel. Do not unplug the machine or use to switch on the appliances or rest yourself to electric quotients. You cannot turn the power. It means source. Do not touch the victim until you have separated him from the source of electricity. Then use wooden broom handle or another dry, non-metallic object to move the person. In preventing electric shock, unplug again any electrical appliances like toaster before removing food or object that had become stuck in the appliance. Unplug electrical appliances from the outlet by grasping the plug, not the cord. Keep cords away from the heat sources or from hanging over the edge of the counter. And dry hands completely before operating electrical appliances. So do not overload power boards. Why? Because this is a cause. Just like the danger high voltage electricity. If someone has been injured by high voltage electricity as from a power line, call your emergency number and tell the operator that high voltage electricity is involved so that he can dispatch both medical and utility crew. Stay at least 20 feet away from the source of electricity and from the victim, as long as he or she remains in contact with the source to avoid the risk of the electrocution. In lightning, unlike other victims of electrical shock, someone struck by the lightning is not electrically live and can be treated immediately after the incident. Call for medical help. If the person is not breathing, use artificial respiration. If she or he has no pulse, apply CPR. If the person has lost consciousness but is breathing, place his or her in the recovery position. Next, respiratory emergencies. In choking, a person chokes when a piece of food or another object obstructs your airways. This obstruction keeps the oxygen in the lungs from reaching the brain, and the person stops breathing. Unless he receives immediate first aid, he can die within minutes. Children under the 4 are especially vulnerable, often choking on hot dogs, peanuts, hard candies, or part of toys. Adults put themselves risks when they fail to chew food truthfully. If you are all alone in choking, try to perform abdominal thrust on yourself by using your hands, a chair, a counter, and the aids of sink. What to do when someone is choking? So, choking, what not to do is don't ask them if they're okay. Instead, ask them if they are choking. Don't attempt to perform the Heimlich maneuver if it can break ribs and cause damage. Don't put your fingers in. Don't give breath first if you need to start CPR. Start with the compression. And do not pick up the child, turn them upside down. Okay. That is the example. If you are alone, so what do you do? Perform this setup for your treatment. Now, in the signs and symptoms or warning sign, by the gasping or noisy breathing, or breathing may stop, clutching the throat, inability to speak or cough, bluish or ashen skin color, swelling, veins in head, neck. These are the 7 signs of symptoms. Short throat, hoarseness, respiratory difficulty, unable to speak or make any sounds, sinus or blueness of lip or nail bed, coughing rapidly, and also the collapse. Before I leave this lesson, I give you this for your task. Safety first. There are 3. Be careful, be aware, and be safe. That's all for today. In your module, please answer following activity. For more updates, please monitor our e-class online learning platform. This is your teacher, Rinaldo B. Malimban. Thank you and goodbye.